Hi, this is Jeff with Wellness Keys for You, and today we're interviewing Dr. James Stone, medical doctor, and he is a medical doctor or hospitalist at Fawcett Memorial and Bayfront Port Charlotte and Bayfront Punta Gorda here in the Port Charlotte area of Southwest Florida. And today we're going to discuss hydration and dehydration. Hello, Dr. James.
Hello, thank you for having me.
Absolutely, it's our pleasure. Okay, first, we'd like to ask you, what have you seen in practice as far as a serious case of dehydration?
In hospital medicine, I've seen a number of cases of dehydration that come in all the time. It is in older adults in particular. As we age, the part of the brain that senses thirst, called the hypothalamus, it becomes less sensitive to how concentrated the blood is. And so as patients become dehydrated, they lose the ability to sense thirst, and therefore they don't drink as much, and they are more prone to becoming dehydrated. So this is something that dehydration is something that accompanies all sorts of disorders, from heart failure to renal failure to pneumonia and other causes of dehydration, like gastrointestinal illness, nausea, vomiting, diarrhea, and any generalized illness that just causes one to have less energy and therefore have less will to drink and to keep up with their hydration. Another one part of dehydration that can accompany young people or young very active people is something called rhabdomyolysis, where when one becomes dehydrated, the muscles begin to break down due to excessive oxidative stress and excessive muscle use. You think of the high school football player who's out in the heat, and they're just they're strong enough and young enough to hurt themselves, and
Yes.
to keep working working harder and harder in the heat, and then they get muscle breakdown and they can become very dehydrated.
Not pay attention to what they're doing.
That's right. That's right. That's right.
Okay, so second question. Could you explain to our listeners the consequences of a chronic, unaddressed condition of dehydration, when people just, for days and days and months and years, are not paying attention to what they're doing?
Yes, I mean, chronic dehydration is something that is what we say in medicine is subclinical, in that people are actually dehydrated, but they're not really aware of it, and it doesn't is not something that drives them to going to see a physician, or bothers them enough to make them seek out a cause. But dehydration can, like I said before in the first question, it accompanies virtually all different types of illnesses. And you see things like lightheadedness, dizziness, inability to focus, not feeling as sharp. You can be irritable. Sometimes hunger or stress can be, or these things can be interpreted as being stress, when in fact they may be related to just simply feeling dehydrated. The consequences of being dehydrated are myriad, because water is the milieu that in which all of the tens of millions of biochemical reactions that are in each one of our cells, that are going on all the time, that we're completely unaware of.
Mm-hmm.
Is that's where these chemical reactions take place. And so the chronic dehydration stresses the body in ways that cause the body to have to work harder.
Right.
And one medical case that comes to mind is someone who has chronically low blood pressure, due to dehydration. The heart has to work faster because it has less blood volume to pump, so it has to pump harder and faster.
And it's thicker.
And it's thicker, but the heart has to pump because there's less volume. It has to pump faster, and these are chronic tachycardia. Can lead to things like heart failure over a period of weeks to months or years if this isn't addressed.
Okay. It's tough to bring beef jerky back to nice supple muscle tissue.
That's right.
Okay, lastly, what would your recommendations be to avoid dehydration, like even regular day-to-day activities, versus the worker who's out all day in the heat, like here in Florida or wherever for that matter?
If you're really concerned about staying hydrated, the best way to measure your level of hydration from on a day-to-day basis is to weigh yourself. It's a quart of water, which is about 32 ounces, or half of a 64-ounce bottle they used to sell in the supermarket, weighs about 2.2 pounds. And so, if you get on the scale, if you weigh yourself each morning, and at the same time, usually recommended after you wake up and after you urinate, to then you weigh yourself. If you weigh yourself at that time every morning, then you have kind of a general idea of how much you usually weigh. And if your weight is off by a pound or a couple of pounds on a day-to-day basis, this is all going to be water. And so if your weight is up by 2 pounds, then it's you're maybe a quart up. And if you've lost 2 pounds, or you come in after exercising and if you happen to weigh yourself before you exercise and then after, and you in the heat and you lose 2 pounds, then you've generally lost about a quart of water, and to replace that would be to drink about 32 ounces of water, over a period of the next 4 to 6 hours, and 8 ounces. So that's and you could in thinking about Jeff mentions the 8x8 rule. For someone who weighs 100 pounds, that may be enough, but you could take the 64 ounces that the 8x8 ounces 8 times a day would mean, and you could multiply it by half to make 96. If you're working a little bit more, or if you're working out in the heat, you could double that.
Mm-hmm. Okay. So it could be a quart short, and the only thing, we don't have a dipstick. We just have to use the scale for a dipstick.
That's exactly right.
Well, okay. I want to thank you very much. I appreciate your time
welcome.
And your input here. And this is Jeff, again, with Wellness Keys for You, and we're signing off until next time. Take care.